Good evening, everybody, and welcome to episode 88 of the On-Air Advocate, where at the On-Air Advocate, we look to provide education, support, and empowerment for everyone with disabilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On-Air Advocate, and I am super excited that you are here joining us this evening, or whether you are catching this on the replay. Now, as you know, if you find any of this content would be relevant or helpful for anyone within your network, please hit the share button and share the love with others. Now, as some of you have been following, we were here this morning, so this is a double header today of lots of awesome information. We have been covering this week Naturopathic Medicine Week, as well as we're covering it is National Health Education Week too, and to top it off, obviously in October we have Breast Cancer Awareness Month. And so I am so excited to have back again with us Dr. Grise. She is a naturopathic physician out of Arizona, and she's amazing. I love when she's here with so much knowledge, and so excited to have you back and you sharing a full segment, kind of all different levels of women's health. So thank you.
Well, thank you for having me. It's great to be back.
Yes. And so I know you had kind of a list of some different things that you wanted to go through, and especially when we're honing in on women, and we do have lots of stressors and all different things that go on. So I'm not exactly sure where you want to begin. And if you want to fill in the audience, I was just thinking of this. Some of people may have not seen you before on the show. If you just want to give everyone just like a little snippet about your background.
Okay, certainly. So I am a naturopathic physician here in Tempe, Arizona, and I am working both in private practice and teaching at the Naturopathic College here. So I teach both in the classroom and the clinic there, and then in private practice, I work with mostly mental health, as well as working with endocrine disorders, hormonal disorders, and autoimmune disease.
Nice. And we know she knows how to teach because she teaches at the school. She can teach us a whole lot of lessons. So take it away. I'm so interested to hear about all these different levels, and especially when we talk about our hormone balance and all of that. So wherever you'd like to begin.
All right. So I think I wanted to first just talk a little bit about the most common kinds of hormone imbalances for women, because there's a commonality among many different disease processes like endometriosis, even breast cancer, fibroids, PMS, things like that have this common link to estrogen dominance. So we have these different kinds of sex hormones in our bodies. Both men and women have various levels of progesterone, estrogen, and testosterone. And then within the estrogens, there's 3 types of estrogen. So we want to make sure that we're metabolizing our estrogens in a healthy way, and that we're keeping a balance of progesterone to estrogen. So sometimes in an estrogen dominant situation, the woman truly does have high levels of estrogen. Other times, it's just that their progesterone is so low that they're in an estrogen dominant state, even if their estrogen isn't out of range high. So then in those cases, of course, we would need to build up the progesterone as opposed to breaking down the estrogen. So each woman is going to have a different cause to her symptoms, but this estrogen dominant idea is something that we'll be talking about today. And this is something that is impacted by the diet we have, but also genetics. So a lot of us, family history where our aunts, our grandparents had hysterectomies or fibroids or breast cancers, things like that. So some of us women are more predisposed to having this issue than others. So there's many factors that will create this situation.
Okay. And so with that, when you're saying high estrogen, all of that, what are some of the complications that can come from that as to why, you're going to tell us all the different things we can do to keep it at the right balance level? What are the different obstacles that people face?
Well, a lot of them are, as far as symptoms go, much heavier period where the flow is much heavier, and even the duration of the period is really long. Another really common symptom is having significant breast swelling and tenderness before the period. Of course, there's some hormonal fluctuations that occur, but when there's a very dramatic change in the size or the sensitivity of the breast tissue, very often that's a sign that there's estrogen dominance going on. And then from as far as diagnoses, that's where the breast cancers, the uterine fibroids, endometriosis, all of those are associated with this estrogen dominant kind of picture. At least most cases are. Of course, there's nothing 100% in medicine, but we see this trend.
Right. And you genetically see it as well.
Certainly. Yep.
Okay.
And so some of us, if we're genetically predisposed to having this estrogen dominance, then we have a lot less wiggle room or room for error with our environmental toxins and our dietary as estrogen exposure, because we're already leaning towards this estrogen dominant state, whereas a woman who doesn't have this genetic predisposition, she may have a little more room for error there without having the symptoms.
Okay. And so you're saying that a lot of these things also, these levels can go up by your food, diet, herbs that are in your diet, those types of things?
Yep. And so that's part of what I want to start with first is what can we do dietarily? So the biggest thing that I always encourage my patients and my students to think about is how do we increase this nutrient called indole-3-carbinol. It is, we nickname it I3C. So this is something that comes from cruciferous vegetables. So that's things like broccoli, cauliflower, bok choy, cabbage, things like that. They're sulfur-containing vegetables that are really helpful for the liver. And why we want these cruciferous vegetables is I spoke earlier about the estrogens and that the way our body breaks down estrogen can be in a more cancer promoting way or a more anti-cancer way. And the indole-3-carbinol helps promote the anti-cancer metabolism of estrogen. Okay. And these levels, so for the women out there listening to this, if you're, know you have a genetic predisposition or some of the symptoms I mentioned earlier are something that you experience, then there are lab tests to look at these estrogen levels. And that's a fractionated estrogen where they look at E1, E2, and E3 to see the breakdown. And many times doctors will do just a total estrogen. And that doesn't give us nearly as much information as if we see these 3 different metabolites of the estrogen to see how their liver is breaking it down. And if it's pushing towards the E1 estrone, that is more of a concern for us, we can notice that on the labs and even give supplements of I3C or other products that have that in a more concentrated capsule form, as opposed to just eating a ton of broccoli, where we can really shift those levels and get them to metabolizing their estrogens in a more healthy way.
Okay. Because obviously a lot of these things, if you were going to try to transfer them with food, sometimes without a supplement, you would have to eat a tremendous amount of them.
Yes. And for many of us, those cruciferous vegetables, those sulfur-containing vegetables can cause gas or indigestion, things like that,
right.
If you're eating a large amount of them. So oftentimes, if a patient isn't used to eating that much of those cruciferous vegetables, then adding in a digestive enzyme or taking a little bit of apple cider vinegar and water with the meals can help them metabolize and break that food down a little bit better without having so much gas, which can be a deterrent for them to want to continue eating those good veggies.
Right. And what were the vegetables that you said again that provide that?
Yeah, so it's broccoli, cauliflower, cabbage, bok choy, things like that. Kale is another one. So they're all
not a lot of soothing things to the stomach. They make the stomach work a little.
Right. But that sulfur-containing aspect of them is what makes them so helpful for the liver. And that indole-3-carbinol is unique to cruciferous vegetables. So the supplement form of indole-3-carbinol is just basically broccoli extract, or that specific aspect of it, into a pill form.
And how do different herbs and things play a role in any of this?
So there are different things that we can do to help modulate hormone levels at the the level of the liver, excuse me,
That
that are
times.
it's a tongue tie.
Level of liver.
Yes, at the level of the liver. So those are herbs that we refer to as cholagogue herbs. That means they help move the liver and help with circulation to the liver. So because our liver is what helps break down our sex hormones, oftentimes that, as from a naturopathic perspective, we're wanting to make sure that the liver is functioning optimally. And so there are some herbs like milk thistle and dandelion root that are very helpful for the liver. Also some nutrients like alpha lipoic acid that can be helpful. But very often when we're specifically working on trying to break down the high estrogen levels, we will likely use a product that has that I3C in it, as well as another product that's called DIM, D-I-M. And it works in a very similar way to I3C, where it helps with the metabolism of estrogen specifically. Now, if the problem is that their progesterone is just too low, then we would do different herbs that can help promote and increase the progesterone. And so a couple of those are like wild yam is one that can be progesterone promoting, as well as nutrients like vitamin C can be helpful in promoting progesterone, as well as just working on their stress response and getting their cortisol levels down. So a kind of indirect ways of working on the way in which their sex hormones are balanced.
And is there a way of testing your cortisol levels?
Yes.
Okay.
Yes, there are. So we can put a link at the bottom in the comments for, there's a couple of kits that you can do. So if you go to your doctor's office, they would be able to measure the cortisol in your blood, a serum test. Typically they do that just first thing in the morning, but that's really just a snapshot in time. Okay. What is often more helpful is if we're looking for just an imbalance of when the cortisol is being released by the body as a response to stress, then we can test the saliva. And you simply order a kit online, or you can get it from your doctor's office, and you'll have 4 little tubes that you'll spit into at 4 different times of the day, and that helps give us a curve so that we can see. We should have our cortisol highest first thing in the morning so that we're up, we're energized, ready to face our day. And then throughout the day, it should slowly taper off to where it's lowest at night so that we're able to rest and go to sleep. For many people, especially, I guess I can't say especially women, but certainly I know a lot of women that I work with who are responsible for kids and running errands and working and just so many tasks, and to come home and having a whole to-do list once they get home in the evenings. Very, very often they will have what we call a reverse cortisol curve, where if we measure in the saliva, their cortisol is actually low in the morning, and they feel it. They feel they're dragging out of bed. They're needing a couple cups of coffee just to get started. And then at night, they're tired but wired, and they can't sleep well. And that is a very often a reverse cortisol curve. And so there's things that we could do to help break down the cortisol at night to allow them to sleep better. And then that gives more of the cortisol to have for the morning time. Most people produce a healthy amount of cortisol in total throughout the day. They're just putting it out at the wrong times. And so then we just have to adjust that by herbs and different nutrition things that can help either bring it up in the morning or break it down at night.
And what are some of those things that can do that? Do you have a couple of things?
Yeah, as far as bringing up cortisol. So if you identify with that feeling really sluggish in the morning.
Yeah, how many people feel sluggish?
Right. and always needing that cup of coffee. So what we would do is have them take adrenal support. So our adrenal glands are what produce the cortisol. And if we're under a lot of chronic stress for a long amount of time, then our adrenal glands just can't keep up, and they get kind of wonky in how they produce this cortisol. So by giving adrenal support, you can use herbs that can help support the adrenals. There's also nutrition, B6, B12, magnesium, vitamin C are they're food for the adrenal glands. So depending on how severe the patient's symptoms may be. We may start with the nutrients, or we may go to the herbs. Or if it's really severe, then we can actually give them adrenal glandulars, which means it comes from a pig. And so bovine, it's a capsule, and it is just freeze-dried adrenal gland. And this will actually replace the adrenal tissue. And so it will help them, give them an instant cortisol boost in the morning.
And that's something you take on a regular basis, like for a few months, or?
Yeah, you would take for a period of time, and then that's not something you would want to be on indefinitely, because we want the adrenal glands in their system to take back over. But if they're so depleted that they really need support, then we might do that for a couple of months and then switch over to doing the adaptogen herbs. Mm-hmm. And kind of continue on in that way, and that less of a replacement, but more of a supportive fashion with the herbs.
Okay. And not to get off, it's still on the same topic, but not to get off of the trend that we're going with, but you had mentioned that magnesium can help. Okay. And so I've often taken magnesium powder, but on the bottle it says calm. So why you wouldn't take that in the morning, but you were saying in the morning, if you take magnesium, that would give you energy, or no?
So magnesium, the MagCalm, that's a specific brand of magnesium. And that's a great one. A lot of people really like that. It calms you, but magnesium does so many things for you. It helps with blood pressure. It helps with mood. It helps with our bowel movements, having regular bowel movements. Mm-hmm. It helps with many different things. So it's rare for magnesium to make somebody feel sedated like some of the herbs can do, or some other nutrients can do. Typically it can be relaxing, but I have many people take magnesium during the day without any change or worsening of their energy. Likely, like you said, it's a nutrient for the adrenal gland. So it's going to be supportive in that. And it would, maybe taking it during the day can make you feel calmer than usual, but awake. And for many of us that are used to being in this fight or flight, really fast-paced way of being, feeling calm, we may mistake as being fatigued or feeling really tired because it's foreign. We don't know what it's like to be alert but calm. But that's really what we want to strive for, is being able to be alert, going about our day, but feeling in a calm, content place, as opposed to being in that sympathetic dominant side of our nervous system, that fight or flight, where we feel that adrenaline running. And unfortunately, here in this Western world, most individuals are in that fight or flight mode for the majority of their day, which is why the difficult sleep is very, very common. Mm-hmm. So this goes into cortisol is one of the big things that I wanted to talk about today, as far as how if we are really stressed out, our cortisol, our adrenal glands get taxed, and we will have this imbalance in our cortisol, but then eventually it can actually affect our thyroid. And our thyroid is really important in how we produce sex hormones. So the stress response, I know we talk about it all the time, right? Eat well and manage your stress, but it's so important. And we're having more and more research that's documenting just how important managing stress really is.
Right.
So it should be
do they feel like some of those supplements, those things like magnesium stuff, are things that they put on the list that are great things to add to your diet on a daily basis to kind of bring those things down? Or do they look at more like the daily exercise, giving yourself relief, getting more sleep, all of that? But like you're saying, you really can't get more sleep. Now that we say that if you're not sleeping well, if you don't manage the other stuff, it all kind of goes in a circle.
Yeah, they all feed into one another. And so I think now if you just took the magnesium and you were pulling all-nighters then you wouldn't be able to, they're not replacing one another. But it's very likely that taking magnesium, no, it's not like a Xanax where you take it and suddenly you're cool as a cucumber. It's not going to be as dramatic as that. It's more of a building, stabilizing that over a matter of several days to a week, you're noticing, I'm feeling a bit calmer. I'm able to fall asleep easier. And very often, part of being in that sympathetic dominant side of our nervous system. If we're running from a bear, we don't pass stool while we're running from that bear, right? So our digestive tract shuts down when we're in that really stressed state. And so constipation, indigestion, acid reflux, things like that can dramatically shift when the nervous system calms down a little bit. And so taking magnesium or supporting the adrenal and the cortisol levels can help the patient move over into that parasympathetic side of the nervous system, where they're relaxed, they're digesting well, they're able to sleep well, but they're still able to function and be alert and go about their day, but in this much more stable kind of way of being.
Right. Now, with you saying that, if someone's listening, because like half the things you're saying, I'm like, oh my gosh, that's me. Oh, that's me. Oh, that's me. If there's other people that are listening or listen to this back on the replay and feel that way, where would you say, because a lot of things you've said are great information, but where would they start? Like, what would be their plan of action? Hey, I'm feeling this way, and I really related to what she was saying. I really want to start to work on this and figure out what's going on with me and get things a little bit back in alignment and in check. So where would they start?
Well, if they ideally having a consult with a practitioner and checking some screening labs in the event that there is something going on, as far as looking at thyroid levels, looking at, the cortisol levels, things like that, where you're just able to objectively see if there's specific areas that need to be addressed. Now, if you've had screening blood work, or you're one of those people that maybe doesn't feel optimally, but according to the numbers, everything looks great, which is something that a lot of people hear, then starting with a small amount of magnesium and seeing how you feel is okay. As long, depending on, of course, if you have any medical conditions or you're taking pharmaceutical medications, you would want to consult with your doctor before adding on even supplements or talking with the pharmacist. But magnesium is, there's very few things that interact with magnesium. And so it's a safe nutrient that we all have in our body. We get from our food that is something that for most people, it would be safe to just start and try. Now
I'm sorry for interrupting you.
Right. No problem.
Would you say, because obviously it comes in a powder form, I know you can take it in a pill form, would you say that one or the other is more effective? And would you say going by the exact amount given on the back of the bottle is what to do? Or like starting out small, like a little teaspoon a day? What is usually your recommendation for that if someone's going to kind of start out slow?
So the Mag Calm is a powder, and there's many other kinds of magnesium powders as well that they have out there. And what I focus on more than the delivery method, powder versus pill, is the form of magnesium. And I believe Mag Calm has a couple different forms in it. Magnesium citrate is really helpful for constipation. It helps to move the bowels a little bit. Whereas magnesium glycinate, it has magnesium found with glycine, which is a calming amino acid. So that is actually one of my preferred ones, magnesium glycinate, because you get the glycine and the magnesium. And so it's a win-win. And with that, usually starting around 150 or 200 milligrams, and just, start with that for a few days, see if you notice any difference. If not, you can go up to taking that twice in a day. And the way that we know if we have hit our upper limit of magnesium, like this, that's very similar to what we have with vitamin C, is that once we are fully saturated, we'll have loose stools. So if you start to have loose stool, then you need to back off.
Okay. Because then that's too much. Now, what about the magnesium you were talking about that usually helps with the bowels? Will the same thing happen if you've had too much? It's just going to have you release it?
It will cause the loose stools.
Would do the same?
Either one would, but the glycinate is the one that I really like, just because you get the added glycine with it.
Okay. All right. And so in the action plan, getting to your doctor, getting some tests done, seeing where your levels are, and then starting to make an action plan with whether that be foods, supplements, or adding in some different herbs. And where would you say, if I'm going to take herbs or something like that, I'm going to call you, because You know what they all mean. But I mean, are there other places on the web, like websites and whatnot, that really give great information? Or would you say if someone was going to start to do any kind of mixture of herbs, supplements, that they should still be contacting not only their doctor, but also like a naturopathic doctor of some sort that does those things versus just diving in? Because I know in past interviews that we've done, you've talked a little bit about the dangers. Like some people don't realize the danger of mixing herbs and that, like they think, oh, well, they're natural, so it's fine. But there's still those dangers there. Like if you don't know what has contraindications.
Yes, and that's the tricky thing, is that with medications, and most medications are metabolized through the liver or kidneys, as are many herbs. And therefore, if your liver or kidneys are not quite functioning up to par or optimally, then what would be safe for one person may not be safe for you. And because of the medications, if there's any interaction with the medications and those herbs, either them having a similar action and causing too much sedation or too much, whatever it may be, or counteracting what the medications are meant to do, then we can have concerns either way. And so it's definitely important to consult with a practitioner and letting your pharmacist know. Now, the tricky part is just that a lot of conventionally trained physicians do not have any say or any experience with working with these herbs. So very often, because they don't have experience saying it's definitely safe, they'll encourage you to just not do it. And so that's where it gets a little bit difficult. And so consulting with a naturopath, an herbalist, even in most states all across the country, even if it's not a state which licensed naturopathic physicians, there are very often practitioners who are trained in natural medicine or herbalists and other kinds of providers who would be a good asset to consult with.
Okay.
And of course, looking online, it's
kind of like WebMD. Are you saying that? Are you saying like, don't do it?
Well, there's good information and there's bad information. And so, of course, utilizing reliable references such as medical school websites are wonderful places. I believe like the Mayo Clinic has a lot of information on herbs and alternative medicines. So, using websites of companies and organizations that you trust. And certainly using PubMed or looking into research would be another way of seeing just what are the studies showing, or what kind of herbs are being shown to be helpful for menopause or to be helpful for PMS. And often
the PubMed, that's a website, right? The PubMed. You can go
Yes.
and then enter in different stuff. Can you later on, after the live, can you just drop that below for everybody?
Of course, no problem.
Link for that. So just to be cautious, making sure that you're asking the right questions, looking this stuff up, but that you are truly consulting with somebody beforehand.
Certainly, because you just don't know, and it's best to have the blood work to know that your liver and kidneys can tolerate everything okay, and that there's no interaction. And so consulting with a pharmacist could be a first step, because if you go into CVS or Walgreens to pick up something, and letting them know of something that you're wanting to try. And even if they don't have experience, they have databases that they can look into. And if they don't know, then they'll likely send you back to the prescribing doctor to ask them.
Okay. And I know that within our network, if you guys are part of the On Air Advocate community, we do have our favorite pharmacist in there who's always willing to answer questions. So if in your area you don't have a great pharmacist that likes to chat about stuff, she is in our private community on Facebook. And so Cynthia, I'll give her a shout out later at the bottom for you all if you have questions, because sometimes it's something that, like you're saying, if their physician has already told them like that they don't do that sort of thing, or a lot of physicians don't believe in those sort of practices, they may shut down those ideas before you even get the opportunity to try some of them.
Right. And I have found sometimes the pharmacists are actually a lot more open and willing to discuss, because they communicate with patients all the time and kind of are, I don't know, often just more open. So,
Right.
yeah.
Right. Now, so that is where they would start on their action plan. Now, I know that we wanted to also talk a little bit about Breast Cancer Awareness Month and
Yeah.
kind of go through that. And all the things that you were speaking about before this obviously are different things we can do for our wellness and our health to prevent some of those things that, may be hereditary or maybe coming on to happen. Correct?
Yes. Yep. And because breast cancers also can be estrogen dominant in nature. And
Okay.
so the other thing to do as far as early detection is doing the self breast exams. And so this is something that as women, we should be doing every month.
Mhm.
And the best time to do it is actually after the period has ended, when the breast tissue often is a lot less tender at that point, and also less of the fibrocystic changes that tends to occur, where often the breasts become a little more firm and sensitive to touch and things like that around the period or during the menses. And so planning on doing it the same time every month, the week following the period typically is the most comfortable for women. And so this can be done in the shower or in the bathroom, in the mirror, where you can first look into the mirror and change arm position. So looking in the mirror, just standing, and then raising your arms up over your head, and then actually putting your hands on your hips and flexing. And you're just changing the musculature underneath the breast tissue. And this is a helpful way to, if you notice any dimpling in the skin or any color changes to the skin, any tissue changes that you can visualize. And then that's followed, of course, with feeling the breast tissue. And so we all have different, the ducts that we're able to feel and fibrocystic changes that many women will have. So really what you're wanting to see is if it's different than it was last month. What's normal for you may be very different than what's normal for someone else. And so doing it on this on a regular basis, you start to know what's normal for you. And so then you're just looking for the slightest change of anything different from that. And then of course, going in and having your provider do the exam, and they may follow that up with an image so that they can visualize the tissue better.
Right. And they recommend now anyone over the age of 40 on a regular basis, or have they lowered that now? Is that like at 35? Did you know if that has changed at all?
As far as doing the self breast exams?
No, going in to get imaging, because I think it's like when you're over 40, I believe it's every single year you're supposed to do it, or if it's 35. I don't know if that has changed, what age they've said
Yeah.
for early detection.
And so in that also, the genetics play a part into that as far as your family history of breast cancers and things like that. So then that age may be bumped up a little bit. But doing the self breast exams can be started in the 20s. This should be something that everyone is doing on a regular basis. The men should be doing their self exams as well, because all of these different kinds of cancers or even infectious processes that can occur. There's many different things that can occur in the breast tissue that the earlier we catch it, the better the outcomes are. And so getting familiar with our own bodies and being able, and it's part of it is just paying more attention. We often kind of go throughout our day just living in our heads mostly, that we're so not even in our bodies. And so there's a really important aspect of doing these self exams, just of connecting with self, but also just feeling empowered about your own health care, as opposed to waiting for a medical provider to do an exam. Don't hesitate to do one for yourself, and you may catch something and that will tell you need to go in and be seen.
Right. And I think that's something you said. I haven't heard from a lot of providers about doing that, where you're staring in the mirror and looking at yourself in different angles and whatnot, to see if you see a difference, and looking at that every month. I mean, a lot of times they go through obviously how to do the self-exam on yourself, but that's a great indicator. I mean, because you may see something different that way that you didn't see the month before.
Right, exactly. Because tumors tend to, if they form, often the skin above them can kind of be pulled in and adhere to the mass. And so you would see a little dimple in that area. And so it may not be seen just standing, but raising the arms up, suddenly you see a dimple on the right side, but it's not on the left. So it can, even if you can't necessarily feel something there, that would still be worth going in and being seen. Another thing that I want to just mention while we're on the topic is if there's any change in nipple discharge or spontaneous nipple discharge, this is also a sign that there's potentially something abnormal within the breast tissue.
Okay.
And so they should be seen for that as well.
Right. So every month, get it on your calendar,
Yep.
same date, same time, same bat channel,
Yeah.
and make sure that you are doing that. I don't know what the statistics are currently right now or how many women per year have breast cancer. I'm going to have to throw that statistic below, but it is a lot.
It is a lot.
So,
and it's becoming younger and younger in age. Many cancers are becoming detected earlier and earlier. And so, though that's why I'm saying, even if you're in your 20s, or you should still be doing these self-exams.
Right. And so much like you're saying also genetically, if it is passed down, you need to be watching for it. And so much of the time we are in our head, because think about how many times you knock into something and you're like, where did I get that bruise? Where did I get that cut? Where did I get that?
Right.
And you can't even remember. And that's the same thing with our bodies a lot of times, is that we're not cognizant and paying attention to all of that. So Dr. Grise, in wrap up tonight, what are some of just the points you just want to wrap up and leave us with?
All right.
Things to remember, things that we can't forget.
Things that I would say are the most important is just trying to eat clean. Try and eat if you can, adding in these cruciferous vegetables certainly is helpful. But in a broader idea, simply eating whole foods, trying to limit processed foods, limit sugar intake, and limit your conventional meat and dairy intake. This is something that I didn't talk about a whole lot yet, but this is another way that we can add estrogen to our bodies by the estrogens in the meat and the milk that we're drinking. So if we're already leaning towards this estrogen dominant side and we're drinking a lot of cow's milk that has more estrogen in it, or eating more conventional beef that often can be treated with estrogen to make it bigger, we're going to be spiking our levels as well. And so really thinking of the quality of our meats, the quality of our produce and things like that, as just as important as a supplement you take. It's prevention, and it's creating an anti-inflammatory state for the body, which is ideal. So diet would be number one. The other thing that I would say is to just try and look at your environment and things in your environment that could be adding to the high estrogens, which are toxins like solvents in your cleaning supplies, your candles and air fresheners, and the having plastic containers that you're heating food up in. All of these solvents and the BPA and the plastics and that line the inside of cans are all estrogenic. So we want to limit what we're taking in from our food, but also in our environment. Okay. And then to wrap it up, just check yourself on the regular so that you can identify a very subtle change in your tissue, so that you can be examined and that can be identified as quickly as possible.
Yes. And the buddy system sometimes for that works. And so I know a lot of our promotional things that we have here in the state of Wisconsin, they talk about, having it on the same day each month and having a buddy that you have, a friend that can remind you, hey, did you do your checkup? Hey, did you do your checkup? And keep tabs on it, making each other accountable.
Right. Well, as long as you find a buddy who has the same cycle as you.
Or maybe you give each other the date and then you.
Yeah, there you go.
No,
that's a great idea.
All right. And before we leave tonight, is there anything, Dr. Grise, that is kind of happening in the wheelhouse of Dr. Grise naturopathic world that we should know about? New webinars, things coming out, or a website that they can go to if they want to find you? I know that you offer usually a little consultation that you can do online, even if you live in a different state. So can you just fill us in on all that before we head off the air for the night?
Certainly. So my website is www.drdianegrise.com, and we can put a little link underneath here. And as far as on my website, there is a form that you can fill out to contact me to do a free 15-minute consultation to talk about what your health concerns are, or if you're out of state, I can try and link you up with a provider who is closer to you. And so I'm happy to talk with anybody who would like to reach out to me.
Wonderful. Well, you are always just like a fountain of information, and I love it. I love it. So when you guys are at the grocery store tonight and you're thinking about the produce, the things you buy, your supplements, if you're awake, you don't sleep at night, you're not awake in the morning, I think we all need to hop online and give you a consult.
I'll put a link to the website that I order a lot of my salivary kits. You can order this online and have it shipped to your house and send it into the company. So even if you don't have a naturopath near you, you can still get this information. So
yes,
you can put that
and
link
then
on
you
there.
can be like, I found out that it's all messed up, and now it needs to get corrected.
Right.
And reaching out. So wonderful. We'll drop all those links below, everyone, so that you definitely can get in touch with Dr. Grise if you have any questions. Also, below this live, if you come back to it on the replay and you're asking any questions or now, both of us will tackle those questions to be able to answer them after the segment. So on that note, thank you so much for being with us again.
Thank you. Yes, it's a pleasure.
And on that note, I want everybody to have a fabulous Wednesday evening. If you want any more content or information about the On Air Advocate, you can head right on over to onairadvocate.com, and all of our services and media sites are right there. Also, if you want to become part of that private community, just head up to the top of this Facebook page and hit the visit group button, and that will let you into our private community. And also, what I mentioned on the other broadcast this morning is stay tuned, because next month is National Caregivers Month, and so we are going to be launching a celebration of the caregivers. So I have lots of stuff in store, planned giveaways, all different stuff. So stay tuned, and thank you again.
Oh, you're welcome. Thank you.
All right. Good night.
Good night.